Question number 12, Barbara Stewart.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, does he stand by his statement, and I quote, Budget 2016 will help New Zealanders continue to access the health care they need?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes. Budget 2016 allocated an extra $2.2 billion to health over the next 4 years. As part of that, the government is spending $124 million for Pharmac to provide more access to new medicines, $96 million to provide more elective surgery, and $39 million to start the rollout of a bowel screening program. There's also an extra $25 million for primary care in the budget, and over time we've increased the number of doctors and nurses in the system by 6,000.
Supplementary question, Barbara Stewart.
Does he believe New Zealanders are continuing to access the health care they need when Waitemata DHB bowel cancer sufferers have to wash and reuse catheters, even though the catheter packaging states single-use only, because the DHB is supplying only half the number needed for patients?
The Honourable Dr Jonathan Coleman.
Yes, and that sounds pretty operational to me.
Supplementary
question, Barbara Stewart.
Does he think it appropriate that New Zealanders, predominantly elderly New Zealanders, are being asked to wash and reuse the catheters, resulting in multiple infections, so that DHBs can save just over $1 per day? And is this an example of the efficiency savings he's demanding of DHBs?
Look,
the Honourable Dr Jonathan Coleman.
Operational, I find that pretty unlikely because, I mean, that would be a source of infection, so that would not be correct clinical practice, and I find it hard to believe that's really happening. So, you know, if you've come and see me about it.
Supplementary question?
Supplementary.
Barbara Stewart.
Does he think it appropriate when constituents do complain directly to his office of this exact situation, they receive one box of additional catheters and then no changes are made to the long-term care for that constituent?
Order. Order. The Honourable Dr Jonathan Coleman.
What I can say is that I'm a local MP in the Waitemata DHB catchment area, and we've had fantastic feedback about the performance of Waitemata District Health Board over time. The services there have just got better and better. It's very well run by Lester Levy and Dale Bramley, and people are actually really happy with the service because they're getting more and more access to the quality health care they need all the time. So, look, if there's a problem with the catheters, come and see me.
That concludes question. Order. That concludes questions for oral answer. I call on Government Order of the Day